Yeah, so when you walk into a child care place and you're thinking about environmental things with policies and such, I assume then you're talking to the director, and then sometimes the director has, an affiliation within a federation of child care centers, or talk about the training process, or what's it like changing the culture of a daycare center?
Well, first of all, let me say that, and as a researcher, our job is to figure out how to solve the problem.
Yeah.
But to execute that, we really rely on the numerous professionals who interact with child care. And so the good thing is that there are a lot of different people who service the child care industry, but they're not organized in a sort of integrated way. So we have CACFP consultants who help child care programs with the food program. There are, in North Carolina, we have child care partnerships that are in local communities, and they have technical assistance staff whose job is to improve the quality of child care. And then there are these federal resource and referral agencies. So they're cooperative extension. So there's a lot of people.
Yeah.
So what we want to try to do is give them the tools.
Right.
And so because they know how to work with the programs, but they need to know what to do. So what we've tried to do is create the resources and the strategies that they can use. And so because it's in their caseload, it's what they do, but they might be working, if it's a child care health consultant, they may be going in and working on diapering and hand washing and some safety issues. But if they understand, for example, oral health, or they understand nutrition, then they can also minister to those centers when they're there. And we like to take a process of sort of reflection, self-assessment at the program level, and say, where are you? And then from there, sort of move them into the area where they feel comfortable trying to make
sort of like an
change.
Organizational stage of change approach.
It's really, we have a
sort of common sense to begin with,
exactly.
But
we use a change management system.
Yeah.
So it's self-assess, action plan, get some information, take some training, reassess, celebrate, your success, and then continuous quality improvement.
Right.
So you can't take, it's not an antibiotic. You can't just get a cure.
Right. Yeah.
But you can take small wins, and then if you continue to add up, then you've got some big wins.
Well, continue to add up. I mean, that really means it takes time to figure these things out. And each organization is a little bit different with different leadership and management practices and styles.